And let's get it going. So first of all, I'm happy to have you here. Part of our OMH conversations, our Melanin Health conversations. I also want to thank you for being a relatively consistent participator in the group. I noticed that, when we post and when we share content, you take the time to respond, engage, and you do share some content yourself. So we thank you for that. As a young growing community, we need people like you participating
Oh,
and
you're
getting
welcome.
down with us. So thank you. Thank you for that. So we are speaking with the famous Gwendolyn Woody. How you feeling today?
I'm well. How are you?
I'm doing great. It's a little crazy out here, but we're not gonna talk about the craziness. We're gonna talk about you because it's about you. So amongst
Thank
all of those
you.
amazing things that you're doing and building, you're also a published author, and that's the last thing I read. And if you don't mind, let's start with that. What's the title of your book, and when did you write that?
So I wrote my book so about 3 or 4 years ago. The title of the book is Brokenness Creates Wholeness. I was married. I went through domestic violence and I had to heal myself. Going to counseling was okay, but sometimes you have to do some inner work.
Right. Brokenness creates wholeness. That's a hell of a title. Yeah. So how long
hmm
ago did you write that?
It was about 3 to 4 years ago.
Yeah. What was that
Yeah.
process like the writing process for writing a book? Because it seems
Lit.
it seems pretty daunting.
So the original plan was to write a book about how I raised my sons in Baltimore City successfully without, all the hoopla, if you will. And then one night at work, I just took, a scrap piece of paper and it came to me. I literally wrote out the title and the chapters. I started to write out some scriptures the next day. Of course, after I slept, um, I just started to write. It wasn't what I would say was a typical process for writing a book. I didn't plan it at all. It just came to me.
Right. You just let it flow. And tell the people where they can find your book, if you don't
Well,
mind.
it's on Amazon. Yeah,
It's on Amazon, so
it's
everybody
on
go
Amazon.
check
It's
that
on
out.
Amazon.
Brokenness creates wholeness, which I think is an amazing title. Um, okay,
Okay.
so diabetes educator. Why
Mhm.
diabetes? What led you to that? Of all the things that you could do and educate people on, why that?
Well, one, because of my family, and two, because people of color are drastically affected by diabetes and its comorbidities. Working in healthcare, I see how, we are treated. I see how we can't always afford um, the proper, if you will, treatments. And I also see how sometimes we're just discarded. Like, we live in those neighborhoods, we don't have food markets, and we're not properly educated uh, in nutrition or health and wellness.
Right. Yeah, I think the education around that is a little bit more accessible than some prior years, some decades before. I can even think about just growing up for me, the things that we would have in our household, just like Captain Crunch and Pop Tarts, and uh,
hmm
it was in the Whole Foods in our neighborhood. But if you don't know, then you don't know, right?
Absolutely.
Right. I think
Absolutely.
I read something from the CDC a while back about I think 3 in 4 Americans by a particular year, 2030, some very close year, would be diabetic or pre-diabetic. That's
Absolutely.
like
So,
almost everyone.
yes, 1 out of 3 adults diagnosed or undiagnosed are considered pre-diabetic. One out
One
of
out of three.
five,
That's beautiful. Okay, thank you. Thank you.
one out of, yes, 1 out of 5 are diabetic, undiagnosed, or diagnosed. Um, and that's just the United States alone. That's not, worldwide, because it is a worldwide thing. Um, and that speaks to, you know, nutrition again, education, understanding, language barriers, um, and a part of, you know, being relatable. That's one thing I do take into consideration when I work with people. Am I relatable to them? Are they understanding what I'm saying? And I think that's, I would say, a quarter of the battle of people being relatable to one another so they can receive the proper education they need.
Right. What would you say are some of the barriers to a proper education about nutrition?
Number one, it would be a good thing if we had nutrition classes in elementary school.
Mm,
I just had this conversation recently that you don't have nutrition. You don't even really have home economics anymore in school. Um, you don't have nutrition classes in school, right? So generations upon generations have not learned how to eat. When you go to your primary care doctor or your pediatrician, they are maybe giving you a sheet, of paper that says you should have the plate, you know, um, from USDA, but they're not really educating you on it.
right.
Even some people tell me that if they receive a diagnosis for diabetes, their physician is not even referring them to a nutritionist or a dietitian. So that's one thing, education, starting at a very young age. Number two, um, knowing that there's nothing wrong with learning how to eat properly, right? We have to take away our pride so we can heal. In the communities that I have worked in and work in, it's like Uncle Johnny did this, Aunt Susie did this, my mom, my dad, yada, yada, yada. But at the same time, we're eating the same thing that Uncle Johnny and Aunt Susie passed from at the repast. Then our physicians, our practitioners, they have to learn us. You know, everybody is not a textbook. No one is a textbook. They have to learn us. So that prescription that they are about to write, they don't know if I can afford that prescription. They don't know what I'm already taking. They don't know what I have to deal with at home, right? They don't know if I'm married and have 5 kids. They don't know if I'm taking care of my parents. They don't know anything. They're just writing a prescription and say, here. Those things need to be rearranged to benefit everyone. Because in the long run, if you have patients that are healthier and know more, your outcomes are better,
Right.
right? And it's a win-win situation.
Right. Those are very good points. One, about the education starting very young. As you know, last month, our theme, our topic for the month was education. There's so many ways in which our community is being failed by the education system. And then if you're not getting it in school, some members of our community, you're definitely not going to be getting it at home. So
So,
where are you going to be learning these things? I think that's a great point. And then when it comes to our healthcare, some might refer to it as sick care. Some institutions are better at that than others. I had the privilege of working at a few like magnet institutions, and I do see the difference, even in the providers, even the level of attention that they pay to their patients, or the time, and even just the time, how they interact. I've seen providers sit down on the hospital bed and just like,
mm-hmm,
it's like I'm not trying to come out and walk away. Like, I'm going to sit down and we're going to talk about how you're feeling. Do you have any more
mm-hmm,
questions or anything I can do for you?
mm-hmm.
And that doesn't happen everywhere. But the
No, it doesn't.
system is set up. I mean, roles are different. Your social worker may know those things about you, about what's going on in your home life and your finances and whether or not you can afford certain medications. Your provider probably does not. Whether or not they have an interest, though, that's another story. And there's
Mm-hmm.
a lot of training and culture and institution. I think you made some very fine points about that. And 1 in 3, wow, those are daunting numbers.
Mm-hmm.
How
Yeah. And
I if you can speak to some of the institutional reasons or the cultural reasons other than education and knowledge why we're so hooked on sugar and why we're so misinformed, and why we're on this road to 1 and 3.
Well, while we are misinformed, I would say has been, sort of a historical thing. People of color have always been the last to know, the last to be taught, because we, quote unquote, in some people's minds, are not supposed to know. Um, we are not supposed to live a life of health and wellness. And so I think the first thing that I had mentioned is that one is access, right? So we don't have food markets in our neighborhood. A lot of our neighborhoods are considered food deserts. And when we do have food markets there, usually the things that we need to eat are outpriced. We can't afford it. We will have a lot of Family Dollars, Dollar Trees, McDonald's, Burger King, Chick-fil-A's, but we won't have the places that we actually need to buy food to nourish our bodies, which in turn, helps attributes to diabetes.
Mhm.
Number two, we are not as active. We are the couch potato generation, if you will. People don't go outside as much. And it's not just because of COVID, right? We have gotten used to being on the laptop, watching the television, children playing video games, and not being active. Years ago, mom and dad would say, get on that bike, go outside, or the whole family would go outside,
Right.
go walking, something. But we have adapted to a sedentary lifestyle. So all of those carbs and bad processed foods that we're taking in, we're not working them off. They're staying with us. Then pride. So even though we have, again, Uncle Johnny and Aunt Susie, they have already had multiple surgeries, had renal disease, had hemodialysis, had even body parts cut off, you know, we are comfortable with taking a pill or injecting ourselves with a medication to say that that's going to take care of my blood pressure, that's going to take care of my diabetes. In actuality, it's not. But because we don't see, we don't want to learn, and we don't know. We don't want to get out of what is comfortable to us, if you will. So if we have our group of friends and they are all from the same neighborhood, how far are we really going to go, right? And that's not just in life, but that's in health and wellness too. So we have really allowed ourselves to basically just survive and not live um, in what we know. We don't challenge ourselves. And another point is that we do not understand what to ask for when we go to a medical institution, when we go to our physician's office. And a lot of persons, you know, they're comfortable with the 5 minutes. I'm not comfortable with the 5 minute visit. And I understand that practitioners have a lot of people to see, but guess what? My insurance, whether it's Medicare, Medicaid, Blue Cross Blue Shield, Kaiser Permanente, whatever, is paying that physician. My monies are paying that insurance company to pay that physician. Their responsibility is to me and my health, and not my responsibility to them. In other words, if I have a list of questions, even if they can't answer those questions face to face, they can call me back, they can send me an email, they can write me a letter. But we don't feel confident to push the edge when it comes to our doctors. I always tell people to ask, and the doctor does not have to respond. What would you do? Is this the treatment that you would want for your mother or father? Is this the treatment that you would want for yourself? Right? They don't have to speak. You're going to see their body language, and that's going to tell you
Mhm.
what they want.
Right. That last one's a very good one. It's a very interesting one.
Hmm.
And I also want to remind people that, other than being a type 1 diabetic, diabetes is preventable.
Yes.
And we're heading to a 1 in 3. That's a lot. Um,
Yeah.
so I'm happy you're out there on the front lines, right?
Thank you.
Working for our people, caring for our people, educating our people. Cheers to you for doing that. Let's move away from diabetes real quick and just kind of step into wellness and self-care in general. Now,
Mhm.
um, you know, last month our theme was education. This month, November, is the month of wellness and self-care. Coincidence that we have a particular political and social climate? Possibly. It seems pretty apropos, personally.
Mhm.
But
Yeah.
I'm not getting into that. That's not what this is about. This is about you. So I think considering the current climate, a conversation about wellness and self-care is important. And it's not just in the context of our political climate. I look at it in the context of the year we've had. I mean, it's important in general, but if you're a healthcare professional, and particularly one that has been on the front lines, as they call it, I don't like this front lines military terms because we didn't sign up for that. That's what they're saying.
That. Mm.
We're on the front lines, um, particularly in certain states, New York, Florida, Texas, where it went down, especially
Yes.
in New York in like May, April. You've seen some things, you've
Yeah.
experienced some things, a lot of trauma, a lot of death. You've also probably learned how disposable you are as an employee. When you are going to work with trash bags, somebody is not caring about your wellness and your well-being. So in the context of
Mhm.
this year, what does wellness mean to you? What does self-care mean to you?
Wellness means to me that I'm validating myself, that I care enough for me to say no to others. Um, and that even means employment. Um, as you said, we are disposable. They can get a nurse from just about anywhere now. So if you're not willing to do it, someone else is willing to do it. I personally, because I've worked 3 of those assignments, and literally you are pruned until you can't be pruned anymore. um, but I realized that I really have to focus on me. I have to be grateful for myself. I have to be appreciative of myself, and I have to be kind to myself. I cannot beat myself up because something did not go right at work. I cannot be bothered with any mischief at work at all. I'm there to take care of the patient, and my goal is to go home without anything and to go home whole and not broken, right? So, therefore, the night before, usually I prepare for the next day. The morning of, I pray and I meditate. Then, when I get there, I plan my day out and I ensure that I take my breaks. As a healthcare worker, as a nurse, I think that's probably the biggest mistake that most of us do is that we do not take our breaks. I leave the phone on the floor, give it to the charge nurse, give it to somebody. I go outside, away. You
Yeah,
have to get away from the floor. Um, and even during COVID, I was in McAllen, Texas, and that was a lot. Um, Literally taking off the layers, go outside, and even pull my mask down because it's a lot to wear a mask 12, 14 hours a day. Nonetheless, 6, 7 days in a row, right? So we have to appreciate ourselves more. We have to value ourselves more. And we have to learn to live. We have to know that even though we are nurses and we care for other people, we have to care for ourselves. You can't care for anyone else if you're not caring for yourself at all, you know?
right, right. So so that's wellness. And that's also in the context of employment. What about self-care? What is self-care other than in the context of employment?
Self care for me is food, like my nutrition, and self-care from relationship with God. Self-care that I practice the most, that allows me to be a better me.
Mhm. Why is self-care so important in general?
If we, in general, because we can't depend on something else or someone else to care for us. If we don't care for ourselves, like if you can't care for yourself, how could you teach someone else to care for you, right? And if you're not caring for yourself, how can you care for another individual? It's a baby step process. It's not something that I did all of my life, but I've learned. I do it. I like it. I love it. So, yeah.
Right. I'm sure you do a lot of things for self-care. What is one of your favorite I'm taking care of me moments kind of things?
Actually, when I get to do my walk, which is 4 to 6 miles a day, when I get to do that, and yoga, meditation.
4 to 6 miles. Nice. Nice, nice.
Yes.
On that walk, do you listen to music? Do you walk in silence? Do you switch it up? Do you talk on your phone?
So I usually don't talk on my phone. I may listen to a book or I may listen to like waterfall music, something like that, but never on the phone. Because that's my time, that's my space.
Right, right. And lastly, I was looking at your page and reading up on you a little bit, and I saw something about you also being a relationship coach, if I'm not mistaken.
Relationship coach?
Or
No.
something about relationship. I saw something about relationship. I didn't make that up. It says it on your Facebook. It says something about relationships in there.
Um, no.
All right.
I'm not the relationship coach. Trust me.
Okay.
I'm like, oh Lord.
Okay. Well, the power of editing is going to help us right now. And let me.
I have to really look peek at that because I'm no.
Okay.
That's
All
funny.
right. Okay, I got that one wrong. So, lastly, in the context of relationships, because you did talk about how you moved into a very different space from where you were to where you are with your own personal
Yeah.
relationships. What
Mhm.
does self-care mean to you in the context of relationships, family, friends, and romantic?
Okay, so for family, and I had to do this, you have to set up boundaries with your family. Parents, siblings, children, cousins, aunties, uncles, you have to. If they continuously or you continuously overstep your boundary and they overstep, everybody's overstepping everybody's boundary, um, it's usually friction. Like we can love one another and we can respect one another, but we are all not going to live the same. We are not going to have the same thought process. We are not going to do the same things. I left my home, Baltimore, Maryland, and I've traveled, but then I moved here, right outside of Houston. So you have to do what makes you happy. If your family does not respect it, that's on them. It's not on you. You have to be happy. You
Mhm.
can't do anything for them if you are not you, if you are not happy. My son says this. He says that we are uniquely us, right? There's only one us. God only made one of us, and we can only live one us. So there you go. And next, I think you said family and relationships, right?
I say family, friends, relationship, but I think it'd be a
So,
consensus with family and friends. But yeah.
uh, okay, so my friends, my girlfriends, um, we have come to this thing where we can talk and communicate, we can go anywhere, but we most definitely respect. And we are adults, so we know when to say, this is too much, you need to stop this, yada, yada, yada. And we respect opinions, but we don't cross the line. Um, if I felt that one of my closest friends were doing something dangerous, of course, I'm going to respond to that appropriately. I'm not going to let them cause injury to themselves. Relationship wise, so if you don't love yourself, you can't love another individual, right? That was the case when I was married. He did not love himself. He did not know how to love himself. So with that being said, if you are in a relationship, whatever kind of relationship it is, you have to learn to love yourself before you begin to love someone else. Why treat them indifferently because you're not secure within your own self, right? It doesn't make sense. And it's a bunch of hassle. Nobody really wants to go through that.
Ain't nobody got time for that.
Nope, not at all.
Learn to love yourself. I think that's a good send off, but I'd like to just add a little positive cherry on top. What are you grateful for today?
Okay. I'm sorry.
What are you grateful? What are you grateful for today?
I am grateful for life, right? Somebody did get up this morning. One of my friends back home, his brother was killed yesterday. I'm grateful for life. I'm grateful for my sons. I'm grateful, to be here talking with you. So I'm grateful for life and opportunity.
Life and opportunity. Well, we'll send it off with that one. Gwendolyn, thank you for participating, being part of the OMH family, being part of this OMH conversation. I appreciate your time and keep doing the good work that you're doing out there for our people.
Thank you.